Welcome back to the stem cell series. This is video number 4. And in this video, we're going to be talking about the complementary therapies that are often used before, during, or after stem cell treatment. If you've ever gone to a stem cell clinic or even browsed their website, you've probably seen a list of supportive therapies they offer. Things like PRP, ozone, NAD+, peptides, or hyperbaric oxygen. They're often pitched as enhancement to make your results better, faster, or longer lasting. But are they really? Or are they just expensive extras that sound scientific but don't actually move the needle? In this video, we're going to analyze which supportive therapies truly complement stem cell treatments. And by the end, you'll know which ones are worth considering and which ones are basically money grabs. So let's start with the first one, platelet-rich plasma, or PRP. PRP is one of the few supportive therapies that consistently makes sense. It's made by drawing a small amount of your blood, spinning it down to concentrate the platelets, and re-injecting that plasma into the treatment area. Platelets release growth factors that promote tissue repair, reduce inflammation, and attracts your body's own stem cells. When combined with stem cell therapy, PRP creates a more favorable environment for these new cells to attach, survive, and start regenerating tissue. It's especially effective for orthopedic applications, knees, shoulders, tendons, and ligaments, where localized healing is critical. And you can think of PRP as a fertilizer for new growth because it helps the cells you've introduced actually take root and integrate. It's not a replacement for stem cells, but it complements them very naturally. When used correctly, PRP is one of the most scientifically supported and justifiable supportive therapies available. Next up, we have ozone therapy. Ozone therapy involves introducing an oxygen ozone gas mixture through IV, through injection, or through insufflation. It's often promoted for immune activation or for blood cleansing. The truth is, evidence in humans is limited, and some studies suggest ozone may reduce inflammation and improve oxygen metabolism, but results are inconsistent and protocols vary widely from clinic to clinic. When used in small controlled doses by trained professionals, ozone isn't inherently dangerous, but it's also not essential for stem cell success. It might have a mild immune modulating or anti-inflammatory effect, but it shouldn't be viewed as a key driver for regeneration. If a clinic includes it as optional support for circulation or detox, that's fine. But if they make it sound like the magic ingredient that makes stem cell works, that's a stretch. Handled responsibly, ozone can be neutral to mildly helpful, but it's never a must have. Next up, we have the very popular IV multivitamin cocktails. You've probably seen this called Myers cocktails. They are IV infusions containing vitamins and minerals like B12, vitamin C, and magnesium. And these drips can help in specific situations, such as when a patient is fatigued, malnourished, recovering from illness, or needs extra hydration before and after treatment. For people who are already maintaining a healthy, balanced diet, the benefits tend to be mild. Still, IV vitamins are safe. They're relatively inexpensive and can temporarily improve energy, hydration, and immune function. So, they shouldn't be considered an essential part of stem cell therapy, no, but they can serve as a reasonable support tool, especially for patients whose nutrient status is suboptimal. Think of this as a minor enhancer, not a cornerstone of the protocol. Next up, we have peptides. Peptides have gained a lot of attention in regenerative medicine, and for a good reason. There are short chains of amino acids that act like signals telling your cells what to do. Some stimulate tissue repair, others regulate inflammation, and a few can even promote new blood vessel growth. BPC 157, for instance, has been shown to accelerate the healing of tendons and ligaments, reduce inflammation, and protect the gut lining. Thymosin B4, often known as TB500, supports tissue regeneration, angiogenesis, and cell migration. These processes directly complement what stem cell aims to do. When prescribed, peptides can extend or strengthen the regenerative response after a stem cell procedure. Results depend heavily on quality and proper dosing, but when managed correctly, Peptides are among the most promising modern tools for recovery support. They're not essential for success, but when used strategically, they reinforce the body's own healing signals safely and effectively. Now, let's talk about NAD plus therapy. NAD plus therapy is one of the body's most important coenzymes, essential for cellular energy production, DNA repair, and overall metabolic function. As we age, NAD plus levels naturally decline, which contributes to fatigue, slower recovery, and cellular stress. Intravenous NAD therapy directly replenishes this molecule, improving mitochondrial function and helping cells use oxygen and nutrients more efficiently. Some patients even report noticeable improvements in energy, in their mental clarity, and recovery time after treatment. These effects are usually short-lived unless paired with good nutrition, sleep, and exercise, but biologically, NAD Plus makes sense because it supports the same metabolic processes that stem cells rely on to survive and repair your tissue. Now, let's talk about massage therapy and lymphatic drainage. Both of them are low-tech, straightforward tools that often deliver high-value results. They help improve circulation, reduce local inflammation, and support the body's natural detoxification pathways through the lymphatic system. For orthopedic injections, gentle massage can relieve stiffness and promote tissue flexibility. After intravenous infusions, lymphatic drainage helps reduce the swelling, heaviness, and fluid retention. The key with both of them is moderation. Treatment should always be gentle and performed by a professional who understands post-procedure care. It's mainly a comfort-oriented therapy, but it also provides physiological recovery benefits by helping nutrients and immune cells reach the treated area more efficiently. Now, these therapies are inexpensive, they're low risk, and they are often worth including for anyone recovering from a stem cell procedure. Next up, we have hyperbaric oxygen therapy. This therapy involves breathing pure oxygen inside a pressurized chamber. The added pressure dissolves more oxygen into the bloodstream, which helps deliver it into tissues that are healing or are inflamed. Research shows that HBOT can support stem cell activity in several ways. First, improving cell survival, then stimulating angiogenesis, which is new blood vessel formation, and lastly, reducing inflammation. It's a well-established medical therapy for wound healing, post-radiation recovery, and ischemic injuries, and the same mechanisms can help after stem cell treatments. The downsides are cost and time. Sessions usually cost between $100 to $300, and multiple sessions are needed for meaningful results. When integrated into a structured protocol, this therapy is one of the few supportive therapies with both biological and clinical justification. Next up, we have low-level laser and red light therapy. These two therapies use specific wavelengths of light to stimulate mitochondrial energy production and enhance local blood flow. This therapy helps reduce inflammation, improve circulation, and promote tissue repair. Some clinics use it to prime an injection site before stem cell administration or as a recovery tool afterward. Research supports modest benefits for pain reduction and inflammation control with minimal risk. It's non-invasive, it's safe, and it's cost-effective. So this makes it a practical addition, especially for patients focused on a joint, a tendon, or skin regeneration. Finally, we have arrived to the simplest and most overlooked supportive factors: lifestyle-based support, lifestyle changes. These ones cost nothing and often make the biggest difference. One of them is hydration. It ensures proper nutrient delivery and oxygen transport to the newly introduced cells. Another lifestyle change is eating a nutrient-rich, anti-inflammatory diet, full of antioxidants and omega-3 fatty acids that supports cellular repair and reduces oxidative stress. Next up, we have that sleeping better makes a difference. Sleep allows your body to release growth hormones and run repair mechanisms during deep rest. And finally, we have the low-impact exercise improves circulation, keeps muscles active, and helps integrate regenerate tissue gradually. So we have that with all of these lifestyle changes, no supplement or infusion can replace them. When these foundational habits are optimized, every cellular therapy works better. Recovery is faster, inflammation is lower, and results tend to last longer. As a final takeaway, we can say that supportive therapies can absolutely strengthen stem cell outcomes, but only when chosen deliberately and applied with purpose. When these tools are used thoughtfully, they make recovery smoother and more efficient. When used indiscriminately or pushed as mandatory packages, they mostly only add costs without clear benefit. In the end, supportive therapies are tools, not requirements, and their value will always depend on how intelligently they're integrated and not on how many are included. Finally, I've included the summary table, which basically summarizes everything we've talked about. And if you've liked the video, please don't forget to like and subscribe. More videos are coming up about different topics, not only stem cell therapy. We're going to go over all of the regenerative therapies that are popular right now. We're going to debunk myths. We're going to go ahead and talk about them. So yeah, stay tuned and thank you for watching this video.